My name is Janie Davis, and this is my Module 2 case study about Jerry. So, some of Jerry's case priorities are he does unfortunately have three cardiovascular disease risk factors. Number one being that his age is well above 45. Number two, he does smoke occasionally. And number three, his LDL is above the threshold of 130. It should also be noted that his fasting blood glucose levels are close to the threshold of 100, so this should be monitored as well. Jerry is very physically active. He owns a wood chopping business, so he's constantly chopping the wood and carrying the loads around, so this constitutes as his current physical activity. However, he did have a recent fall getting on his tractor, which is concerning, and at his last visit, he noted a loss of proprioception and a loss of grip strength, and he has also been diagnosed with sarcopenia, which is just a condition of overall decreased muscle quality, and that is expected to happen in people of his age range because as you age, muscle quality definitely goes down, but it can be mitigated through exercise. Some of the considerations for Jerry are that he does have osteoarthritis, which causes joint pain, so some exercises for him might be avoided. And he does have diminished confidence since he's already fallen once, which might cause him to be scared to exercise because he might not want to fall again. However, he should be encouraged that if he does start an exercise program, this will actually in the long run decrease his fall risk. And he is on three medications, number one being Celebrex, which is an anti-inflammatory. This could inhibit the recovery process from exercise just a little bit, but this is not guaranteed. Number two is lisinopril, which decreases his blood pressure. And number three is rosuvastatin, which decreases his cholesterol. And this could potentially cause muscle pain during exercise, but once again, that is not guaranteed. So in order to assess Jerry's fitness, we will do the Berg balance test, which is 14 balance tests. Some are including the sit to stand test, standing at a normal stance with eyes closed, eyes open, the tandem stance, standing on one leg, picking an object off the ground, as well as many others that just assess overall proprioception, since this is something that he noted he struggles with. We will also assess his grip strength with a handheld dynamometer as shown in the middle photo, since that is another area that he noted that he struggles with. And finally, we'll do the senior fitness testing protocol with him, which are just 8 basic tests, such as the 8-foot up and go test, a sit and reach test, a 2-minute step test, and a sit to stand test, which all just overall assess his basic fitness, his power, his muscular strength, his flexibility, and this is designed for people of his age range. Since all these tests do not require much expensive technology, they do not require much client familiarization, and they don't take too long, they will all be done in one initial consultation with Jerry. So the first article I looked at compared a supervised versus an unsupervised exercise prescription, and it tried to see the effects of the both prescriptions on balance and muscle power in adults of his age range. So these adults were 65 to 80, which very much fits his age range, and they were all healthy, but they noted a decrease in balance and strength, which once again is expected for people of this age category. In this prescription, there was an unsupervised group, which did these exercises at home, and there was also a supervised group, which did these obviously under the supervision of an exercise professional. This study consisted of 36 sessions over a span of 12 weeks, and it focused on static balance as well as dynamic balance and strength and power exercises. The static balance consisted of many bilateral stances, as shown in the top left corner, and the dynamic balance just consisted of normal gait at a normal velocity. And then the strength and power exercises were many exercises, including squats, standing back extensions, planks, calf raises, and standing leg side abductions as seen in these photos. So the areas that were tested during this program were static balance, stride length, stride velocity, functional reach test, and 8-foot up and go test. And as you can see, the static balance improved in both the supervised and unsupervised group, while the control group decreased. And the way the static balance was tested, where the subjects were asked to stand with their feet together, eyes closed, arms out in front of them with their palms supinated up. And if they were disturbed in any way, if they opened their eyes, if they lost balance, if they moved their arms or their legs, the timer was stopped, and the average amount of time that they could stand without loss of balance was noted. And so you can see here that both interventions improved that category. The stride length and stride velocity both correlate to gait and mobility in this population. And you can see that both the supervised and unsupervised groups were able to increase their stride length and also walk faster, while the control group decreased in both of these areas as well. The functional reach test just determines how much balance and stability somebody has in a certain sphere until they are unable to regain that balance. And so, as you can see in the table, both the supervised and unsupervised groups once again improved in this category, while the control group decreased. And then the 8 foot up and go is a time test to see how much power a individual has as they're walking, basically how fast they can walk this 8 feet and turn around and walk back. And so you can see here that the supervised and unsupervised groups were both able to decrease their time. The control group also did, but it wasn't significant. So this intervention proved successful for both the supervised and unsupervised groups. The next study I looked at compared balance exercises with strength exercises using TheraBands, and it looked at muscular strength and balance in people around the age range of Jerry. So the average age of this study was 75, which Jerry falls out of this by only a couple of years, and all these people in the study were indicated at being at a fall risk. And so you can see here that there were two different groups. The group 1 did balance exercises such as sidestepping, tandem walking, retro walking, braiding, one leg stance, and external perturbation, which just means they were disturbed in a way that an outside force influenced them and they had to try to regain their balance on their own. And then group 2 did multiple strength exercises with TheraBands, including squats, heel raises, hip flexion extension, knee flexion extension, and ankle dorsal and plantar flexion. And so muscular strength in 7 different lower body muscle groups was tested throughout this program. It was tested with a handheld dynamometer by somebody measuring the strength of all these muscle groups, and a fall index score was also used on a Tetrex machine. And it should be noted that a fall score of 0 is 0% chance likelihood of falling, and a score of 100 is very likely of falling, so a lower score is better. So you can see in the table that group 1 and group 2 both showed improvement from beginning to end of this intervention throughout all 7 muscular groups, which is very good to see. But the group 2 had more significant improvements, especially in the knee extension, ankle dorsiflexion, ankle plantar flexion, which the ankle is very, very important in proprioception and preventing falls. And so it was noted in the conclusion of the study that the strengthening exercises with the TheraBands were more influential on this population than just the balance exercises alone. But also it should be noted that the fall index score improved greatly in this population in both groups. So both of these exercises were beneficial. And the last study I looked at compared BRACE exercises, which stands for Balance, Resistance, Aerobic, and Cognitive Exercises, with this proprioceptive training. And it looked at balance and mobility in people with knee osteoarthritis, which very much relates to Jerry since he does have osteoarthritis. And participants in the study were aged 50 to 70, which once again, Jerry falls outside this age range just by 2 years, so this relates to him still. And group 1 in the study did the brace training, and you can see their exercises on the side. They did several different stance patterns as well as chair rises, stair climbing, 6-minute walking, cycling, and actually counting backwards for the cognitive exercises, which is very interesting. And you can see here that from pre to post intervention, there were improvements in the Berg balance score as well as the timed up and go. And also this group was able to stand for a longer duration on firm surface and a foam surface with their eyes open and closed, which means their proprioception greatly increased from this intervention across the time span. Group 2 of this intervention, once again, they had knee osteoarthritis, much like Jerry, and they just did multiple different stances, and they did steady training, dynamic training, and functional training, such as walking and sitting down, but this was not as extensive as the brace group. And so they did have improvements in the Berg balance score, the timed up and go score, as well as the standing on the firm and the foam surfaces. However, the people who did this study noted that the changes in this group were not as significant as the brace group. So brace training might be better in training balance and mobility in this population rather than just the basic proprioception training. So, last but not least, my exercise prescription for Jerry starts with a walk at a normal pace for 10 minutes, 3 days a week. And to progress, he will eventually do this for 15 minutes, and this just gets him warmed up for the rest of the workout. Next, he will do squats with mini therabands. As explained in one of the previous interventions, this helps increase strength and balance, and the added TheraBand kind of challenges that balance a little more than just a traditional squat. He will begin this with only 3 sets of 10, and to progress, he will move to 4 sets of 12. Next, he will climb 10 stairs since his home does have an upstairs level which he lives on. And this affects his activities of daily living. So if he can do this, then he will be able to live better and improve his quality of life. Originally, he will only do this 3 times, and he'll try to climb those 10 stairs within 30 seconds. But then eventually he'll do it 4 times to try to climb them within 20 seconds. Next, Jerry will do standing upright leg abductions, which will help improve his gait. He will start with 3 sets of 10 each leg holding onto a chair, and then he'll move on to 3 sets of 10 each leg without a chair, and he can add a midi band if he's comfortable. Finally, he will end with a tandem stance and a single leg stance to improve his balance as told by many of the interventions that I looked at. And he will begin with 3 sets of 20 seconds on each leg and move to 3 sets of 30 seconds on each leg. And this is once again to improve his balance. And it should be noted that all of these exercises are closed kinetic chain exercises. And these are my references. Thank you.